As most of you know, there are really two principal ways of doing hair restoration or hair transplant surgery. There is FUE, follicular unit excision, and FUT, or follicular unit transplant. FUT is a bit of a misnomer because both FUE and FUT uses the technique of follicular unit transplantation, that is transplanting single follicular unit grafts. However, it's just become a sort of a abbreviation for the strip procedure, is also known as single strip elliptical excision, or SSEE. So bottom line, for sake of ease, there are two methods, FUE and FUT. Nowadays, there's been a gaining popularity of FUE, especially over the last 5 years, and there is a good reason for that, because the technique has gotten considerably better over this period of time. And there's a lot of stuff on the internet that is either anti-FUE or anti-FUT. A lot of times because the person only does FUE, so they have to badmouth the strip procedure, or there is strip doctors that only do strip procedures and they have to badmouth FUE. So a lot of this stuff out there is a lot of marketing hype and propaganda that I find really, really terrible. So I want to talk to you not about the pros and cons of each procedure per se, because that takes another whole podcast, and I've done actually a lecture for the coming ISHRS meeting about my philosophy of the pros and cons. I may briefly touch upon that, but I want to wipe away a lot of the negative press about each procedure because it's used in an inappropriate way to scare patients from one or the other procedure because the doctor only performs one technique. So first I want to address what you see online right now about the FUT or strip procedure. You see these websites or advertisements that show that the strip procedure is outdated, it's a dinosaur, it's scary because you have this big ugly scar, whereas FUE there's no scar. So first of all, that's absolutely erroneous. The FUT procedure, if done well, may have a few millimeters of stretch back, but in most cases it can be so difficult to see that you can't even see the incision unless you shave the head all the way down. And so that's the negative comment. But briefly, as I said, I won't going to talk about too much about the positives, but there are so many positives to a strip procedure. Women in particular, it just makes no sense for me to do FUE in the vast majority of cases because they're never going to shave their head. They don't want to take donor hair from an area that's not high quality, which is the temple area for them. And they also can feel a thinning of the hair with FUE. It's not a great situation for most women. And also, they have to shave their head. Or if they do a non-shave technique, it takes 2 full days of their head lying down in the pillow. It's just absolutely outrageous and crazy to me. So there are cases where strip procedure really does work well, and including total donor preservation. I get longer and longer into it, and I really want to do that in a separate podcast. But suffice it to say that the strip procedure, in terms of a beautiful incision, really, really is dependent on the surgeon doing it and really carefully picking the right patient. Not everyone should have a strip procedure, but I think there's all this terrible stuff online that denigrates FUT or strip procedures because the surgeon only performs FUE and they don't know how to do FUT, and they try to do everyone through FUE, and it's not the right answer. I want to talk about the flip side of this. Doctors that only do strip procedures talk about how bad FUE is, and that's not the case today. I would say about 5 years ago that was the case. So the biggest offense against FUE is that the grafts don't survive well because they're skeletonized, stripped down, bare, and damaged during harvesting. And to be very frank with you, about 5 years ago, those grafts were not that awesome. The survival rate was significantly lower than FUT. The grafts were skeletonized, thin, and did not survive quite as well. I've always been able to handle the grafts well despite that, and I've been doing FUE for many years now. But in the last few years, I've been doing a lot more FUE because of the improvement in the graft survival. In some studies, they've actually shown the survival to be identical. There are some caveats to that. I don't want to go into too much detail with that, but the answer is that, I think I did talk about, I had a whole podcast about FUE, FUT graft survival. So you can listen to that podcast where I go into more detail. However, the FUT surgeons that say, FUE is bad across the board because FUE grafts don't survive, that's absolutely false. The FUE grafts today survive almost on par with FUT, if not close to being that same level. So you're going to hear people that only do strip procedures that say FUE grafts are horrible, they don't survive, they're terrible, and that was the case many years ago. It is really not the case today. I think the graft survival is very close, if not on par with FUT. There are some exceptions to that rule in terms of grafts that are a little bit skeletonized and a little bit splayed, but in general, the graft survival is really, really good. The other thing you're going to hear about is really diffuse over-harvesting, and unfortunately I've seen this, and you talk about a linear scar of FUT that's bad. Diffuse over-harvesting is the worst thing that can happen, which is someone way over-harvesting the back by inexperienced surgeon or technicians that shouldn't be doing it, and they have a complete loss of the backside of their scalp. It's thinned out, completely thinned out. And I've actually seen a double whammy, which is a patient that came to me that had way over-harvested FUE, plus he had over-harvested FUT with multiple strips. So he just had the most disastrous situation that I didn't even know how to entirely fix. But I've been doing SMP, or scalp micropigmentation, to try to get him somewhat decent with selective FUE to cover the scars of the FUT. Basically disaster. But over-harvesting is something that's there, and that's why FUE does have a more limited total donor capacity for future harvesting. That's going to be a topic of a different podcast. But for doctors that do FUT that say, look, you're going to lose all your hairs, with FUE, that's, again, over-marketing hype that is terrible. So I don't want to go into too much detail about all that because that's, again, I can do podcasts on each of these subjects. But I do want to talk about how FUT surgeons talk about FUE being just horrible. The other thing you're going to see is that FUE is scarless, and this is, again, something that FUE surgeons talk about against FUT, which has a scar. Well, it's true that FUT creates a linear scar, but it really, FUE actually per scar has total more per square centimeter scars than FUT. It's just not visible from a shorter hair distance. But when you shave all of it down, you actually have hypopigmented white dots. It is not scarless. So people that say FUE is scarless, again, is over-marketing hype, which is used to sell something. So I really hope you as a wise consumer can cut through the garbage